time because it's going to make a big difference for the day, especially if you're caring for other people. Now, you're entering that job, you're taking care of that individual with all that energy building up. If you take time to know where you are, you will then know how you can address and how you can move forward for the day. So if that's what I wanted to do, it would be 5 minutes in the morning, taking time to know your stress levels.
She stole my notes. No, I'm kidding. I think those are great points. I appreciate that. Peter, I think, was making some great points too. It's about understanding the stress levels. And I think we're, as caregivers, we're always looking at the person in front of us, the patient, the individual we're working with, and worry about where they're at, but how often we look at where we're at, right? And what are we bringing to that interaction? So every time we come into another interaction with another patient or a person you're working with, like when I'm working with patients in the office, I have to make sure that when I walk into that room, what am I bringing with me, right? Where am I at? Am I bringing my best self there? And if not, what do I need to do to get myself in the best space for that person, right? Because I can't serve them if I can't be the best version of me. So a lot of times it's about what's that self-care look like? And to check in with yourself, like you said, and to really see where am I on that? You know, that pattern of the red, the orange, the yellow, the green, where are you there? It's not enough to know where your person, your patient, your individual you're working with is. Where are you? And sometimes what are those little things we can do to kind of bring ourselves back into the moment, take us out of that red or orange zone if we're there. Sometimes it can just be that 5-minute check-in with yourself, see where you're at. Then what do you do with that, right? So if you are stressed and you are in that space, well, how do you maybe take yourself back? Well, breathing. The 4x4 breathing is a great way to do that. Sometimes with our patients, we'll with the ordinary typical, it's Pape. We do a similar kind of thing. We get them into Vegas, get them into that rest and digest, out of that fight or flight. So sometimes we'll talk about, sniffing the flower and then blowing off the petals. So that's the breathe in and breathe out. We'll use a little pinwheel or something like that. But sometimes just taking a minute and just saying, all right, what's going to lift me up as the practitioner or caregiver? How do I tap into that so I can come and be back into my body and into myself and check where you are? So sometimes it's simple, just maybe it's breathing, maybe it's something, you put on a little video or a song or something, just kind of put you into a different mood. And if you do have a support staff around you or people you can work with, how do you say, hey, I need a minute. I need to step back. Because we don't, if you look at who we are from an evolutionary standpoint, we would have periods of stress and then not. We could take a step away from something so the levels would come down. But nowadays, we don't really, the tiger's not chasing us all day long. We have lots of little micro stresses that don't go anywhere. And when you're working in this world, really, when you really get a chance to be the one that's important, right? So sometimes they just build and build and build. So sometimes even just that 5 minutes away to take a tap, breathe, walk around, sit and eat mindfully. How many of you don't actually sit to eat, right? There's fight or flight and there's rest and digest. You can't do both at the same time. So if you're eating in the car or standing up to eat, and say, sit down, take a minute, breathe, chew your food, pay attention to where you are, what you're eating. Those can be good things. If you don't take care of yourself, you can't take care of others. So I'll say one last point now. So I use an analogy of the airplane. Most of us have been in an airplane before. And we're not actually paying attention to what the flight attendant says before you take off. It's what if you lose cabin pressure, right? Well, the air mask will drop down from the ceiling. Who are you supposed to give it to first? Exactly, because if you don't give it to yourself, you can't take care of anybody else. But who does that in their life, right? And as a caregiver, we're almost trained to not put the oxygen mask, not the gas. The oxygen mask on yourself. You might feel like you're putting the gas mask on, but yeah, you have to take care of you. You can't take care of anyone else. And we kind of I'll take care of you later. Well, sometimes in that moment you got to stop and take care of you, and you can't take care of anyone else. So
absolutely. Thank you.
Yes.
Sure.
You heard plenty from the oculist. When you're not pausing and you don't deliberately, it's not just about your body, right? I mean, yes, you can take some breaths, you can kind of calm yourself in the moment, but that narrative that you're engaged in and what you're telling yourself, the thoughts that go along with the vigilance that just keeps kind of moving forward almost without you, try and, when you do pause, to see what that looks like. What's that ticker tape? Almost like a news program going in your brain, in terms of when we teach CBT skills, tap into your thoughts. It's almost unconscious at some point, right? But what's that narrative which is not good enough, not good, I'm not my best self. One more time, I'm not my best self, right? And practice self-forgiveness. Recognize it and say, not my best self, a good enough self, right? This is the best I can do, it was good enough, and really try and mean that and reflect on it. During COVID, man, did I hit a new baseline of what the heck am I doing for anybody when I showed up at work? And there are days I showed up, I felt like I was at 20% of myself. And I had to accept that at some point. The stress and the not sleeping and the demands that were put on the psychology department to be the helpers of everybody else. It was a lot, the whole stress first aid approach. So I really had to learn that self-forgiveness stuff, or good enough for today. Try to do tomorrow.
I might go a little more pragmatic here. So again, the Spirit of Huntington is a community arts center. It's an amazing organization. Started with 3 kids in a gas station. I always start that with a story because to see what happened, the transformation that happened in that little gas station in the corner of 25A Park to now we have over 500 students a week come through our program. And being able to see what creativity does, and that's kind of where I want to kind of tap into a little bit because we believe creative expression itself transforms lives. And we see that every day at the Art Center. And, being able to be around the community, which it is, and offering those opportunities of art and music and clay and ceramics and yoga and movement, and now into digital art as well, and showing people they can have a career in this vocation of art. It's just been amazing. But going back to the core beliefs that creativity unlocks that stress, right? It gives it that respite moment. So when people come into our community arts center and they're flying 100 miles an hour and they're stressed and they're learning to now sit for a moment and get out. It's that zoning out moment that happens. When that magic happens in the classroom, then you're connecting it, right? From the caregivers, our friends, their families, whoever is with them, we encourage them to do the same thing. Because a lot of times the caregiver will just go, all right, now do this thing and do this, and they're not even focused in it, right? But we're encouraging that participant who's with them or their family or their friends to actually do it with them. Pick up that same piece of paper, take that same piece of clay, because we all benefit from that creative expression, from that opportunity to just forget about life for, a couple minutes and zone into that inner child that we all have, right? And being able to express it. And then at the end, to be able to share what they felt when they were doing that. Again, it's that sharing, right? So when we're in this environment and everyone's sharing and everyone's being a part of it, that's when all that magic happens. And at the end, I don't care if they put one dot on a paper, it's the best dot I've ever saw, And that's what's so powerful, is being able to then say, well, what did that dot make you feel? And what do you like best about your dot? And then it's letting the imagination come in and tell those stories, because we're all about storytelling too. So I just encourage all of us in this realm to go back to those creativity moments that we all forget about, that we all put away, like some of the famous artists said, the Picasso was like, you got to be a child again, right? Get into that art, get into that expression, because that does get you back to a really healing place.
Wow, great answers, and I'm the last one. So imagine if you didn't take a shower. Yeah, that's where I'm gonna go. Imagine if you didn't shower, you didn't take a shower on a daily basis, you didn't wash off all the dead skin cells, or the day, or if you shower in the morning. That's what you're doing if you're not doing energy hygiene. So it's a new kind of term for many, but it's crucial. So when I see folks that come in with high anxiety, or they're coming in with an illness or a disease, or they're coming in with just something off. And I have several folks that are neurodiverse. They come in, and it's really about just cleansing, just having this energy hygiene so that you can sober up the mind, you can think clearly, no matter where your brain is, or we're all neurodiverse, we're all different. But it's the same concept of going into the shower and washing your hair and washing off, the morning, the day, whatever it is. It's so, so crucial. My tip for caregivers is to have a practice in the morning, have a practice in the evening. And it doesn't have to be long, but either through meditation, through breath work, through a simple yoga move, or even simple Tai Chi. In Tai Chi, we gather up the earth and place it in our heart space, and we gather up the heavens and place it in our heart space. We reconnect, and that's how we sober up that mind from all this chaos and perhaps a lot of white noise that prevents us from thinking clearly, making good decisions, and having that third eye really nice and clear, that intuition. Loved what Peter shared with Laura and Emily. Boy, that really spoke so clearly about the importance of having your intuition, and energy hygiene will do that.
Thank you. So I'm going to start back with Yvette. That as both a registered nurse and a longtime member of the OPWDD team, you have a unique view into the physical and emotional toll that caregiving can take. And from a clinical wellness perspective, what are some of the most common health challenges that you see in caregivers of individuals with IDD? And what type of proactive steps can we encourage to prevent long-term burnout or illness?
Okay, over my 37 years, I would say most of the time what I was seeing as a challenge is people felt like they weren't heard. In meetings, things sometimes will get, a little hectic, and it all boils down to not being heard. So I would suggest, or I feel like the best thing that we can do is, as we move forward, is to listen to the caregiver and offer support. I don't know what kind of supports they have now, but I think there should be caregiver meetups where the caregivers can work amongst themselves to share information, even if the facility or the agency is proactive in it and setting it up, but allowing quarterly or semi-annual meetings where the caregivers can touch base, and also having somebody assigned to the caregivers to hear their perspective, to hear what they feel and what problems they're having, so that we can address their concerns. Because again, if the caregiver is not able to adjust or function, neither can the individual. So that's what I would do, more be support and listening to the caregivers, the individuals. Not only that, the staff, who sometimes work with the individuals more than anyone.
Dr. Pape, your work at the Vitality Center emphasizes functional, integrative approaches to health and wellness. How can caregivers who often prioritize others above themselves begin to incorporate even small practices from functional medicine or integrative wellness into their daily lives to support their own vitality?
Great, thank you. So I think I started talking about a little bit earlier about, putting yourself first sometimes, and that doesn't make you selfish, or it means you're taking care of you so you can take care of others, right? So, in my practice, we're dealing with patients with folks, anyone from all walks, whether they're caregivers or with disabilities or anywhere in between, but it's about, helping them get well. So I can talk to you about community chiropractic care and things like that, but when it comes to what can you take home today, there's definitely some things we can do. How do you make yourself the best version? Well, yeah, taking time for yourself is part of that, but what do you do with that time outside of when you're working? Yeah, taking a few minutes to breathe and eat is great, but what do you eat? What's our sleep like? Are we giving ourselves the right nourishment, right? We're turning over 500 billion cells every day. What are you giving your body to rebuild that? If you're building a house, what kind of construction materials you're gonna use? What kind of building blocks do you use? You're gonna find the contractor with the cheapest, most sub-fun, cheapest, I can't speak today. Cheapest construction materials, or the one maybe a little more elite. You have to live in that house, right? Where are your body, where do you live? So what kind of food are we nourishing ourselves with? So sometimes it's about some basic nutritional practices, right? Are we getting healthy food? Are we eating a lot of carbs? Are we eating a lot of fast food? Or are we gonna eat something a little bit more homemade, nourished? I talk to patients a lot about pulling out inflammatory foods. Not everyone has to be gluten-free, dairy-free, soy-free, but these are things we talk about that are not great for your gut. Are you doing some basic gut nutrition? Our gut's 80% of our immune system. It's a big part of what's going on with us. Do you take a good, healthy probiotic? Maybe some digestive enzymes help your body break down this food. Where are we getting our sources of our food? Are we getting more healthy organic sources of our food, non-GMO sources? Are we getting, grass-fed meat versus maybe corn-fed? We can go down the rabbit hole a little bit, but it's also about what are we putting into our bodies. So that's a big part of it. And sleep's another big one. We talked about it a little bit earlier, we were talking about Peter, but what's your sleep like? Are you actually getting to bed on a good time? Are you going to bed late, getting up early? And when you are sleeping, is your phone right next to you? Or, is the TV on? Those are not gonna allow you to maybe fall asleep optimally or even get healthy sleep. I usually recommend a couple of things anyone can do, especially if you have trouble falling asleep, is an hour before bed. It's gonna sound crazy. Turn no more screens for an hour before bed. That sounds like antithesis, but that's not how, 20 years ago was that like. Don't have the TV on in bed, don't have the phone next to you, maybe some blackout shades so you really keep the light out, right? Especially if you work nights, you need to be able to kind of, which I don't like people to do, but sometimes we gotta do it. Keep that light out so you can actually really get that deep sleep. Turn the phone off, maybe take the phone out of the room, or at least turn it off, or put it on airplane mode on the other side of the room so it's not right near your head with that. The really crazy thing is some people I tell, turn the Wi-Fi off after 7, 8 o'clock at night. Everyone's gonna be on here screaming at your person. But all of those things are just things of noise that our brains and our body are being taxed with. So it's, we talk about trauma, that's the load, right? What's the load that person comes to you with? What's the load that you're under? And trauma is one of them, right? It's one of those things that tech and all these other toxins, things we're putting into our cup, fill that to the rim. So what do you may not be able to take some of the stress out of the day of what you're dealing with. But at the end of the day, can you take other things out of your cup so they're not sitting at the ebb lip and everything just flows out? So healthier food, good use, getting good sleep, seeing your chiropractor, make sure your spine is healthy, your brain and body are communicating optimally. Things like that are all helpful tools that can help you to maybe be the best version of yourselves and maybe able to handle the load a little bit better. And really that's what it comes down to is how much that load is there. Because when we deal with these kids who are neurodivergent especially, we talk about, they can't handle, they don't have stress because they can't process. We know that's not true. They're the most empathic. They will feed off your energy more than anybody. So it's really important for you to take your load down as much as you can. So these ways, just when you come to them, you don't come to them with your stuff. So then, because they'll reflect that right back at you. So maybe jump through the phone.
Thank you. Peter, much of your work is trauma informed. How would you define wellness in the context of trauma recovery for both individuals with disabilities and their caregivers? So how would you define wellness in this context?
I'm agreeing with Yvette. And so much of our work that we're training therapists, and we're trying to teach trauma-informed care, so much do not overestimate the power of validation. You don't have to get to the change behavior yet. And if you ever work with an adolescent, and we're teaching therapists to connect with adolescents, you have 100 miles of validation before you get to any change readiness, right? You want trust, you want them to be able to believe what you're going to say and trust in the intervention, behavioral activation or some anxiety technique or some coping toolbox you're going to help them get. You got 100 miles of validation first, right? Imagine trying to validate Laura, that parent. How advanced does your empathy have to be for her to ever think that you really got it? You got it, right? You're going to say to her, wow, I mean, what an amazing journey. Yeah. Can we get to the, do I need an attorney? So validation. So when we're teaching young therapists about validation, there's Rogerian techniques that we teach them is really interesting. And if you do role plays with what we call verbatim responding, where somebody comes to you and they say, my husband he can't do it anymore. He's so annoying. You say, your husband, he just can't do it anymore. He's so annoying. It's amazing that even in a role play, in a very contrived situation, the person lights up. Like, yeah, he's so annoying, right? And that's just a simple reflection, verbatim, saying what you just said and repeating it. That's all that is. And that gets so much from somebody, even in a contrived situation. Never mind something more genuine. So imagine taking that, now adding to advanced empathy strategies where you say, let me see if I got you, if I got this, right? And then you kind of summarize and repeat what they say, and really they see you trying. And that's how you get validation. I mean, that's validation. You say, let me see if I got this. No, right? That's me and my daughter. Still. Everything is no, right? Let me see if I got it. No. Again, you got it wrong. Okay, I'm trying, right? Does it count if I try?
Thank you. Michael, the Spirit of Huntington really offers a beautiful example of how art and music and dance can uplift not only individuals with IDD, but also their families and support networks. You started to speak a little bit about, the caretaker's role in, expression through your work. Can you speak a little bit more about what the Spirit of Huntington is doing with caregivers and for them?
Yeah, I think part of that is the validation, which you just said, and we try to validate all of our programs, and I think everyone needs to feel that acceptance, obviously, that they're part of the world, and we do get down to the base level of meeting them there. But I think more importantly, it's if you're in our programs, and I'll just give you an example, like of our art class. So we study a different artist each week. So if this week is Van Gogh, we learn about Van Gogh. We learn what that person overcame in their lives and what was so impactful and what's so great about him. We do it through slideshows and books, and then we do a project in that style, in that vein, a Van Gogh-ish, right? And then next week it's a different artist. Next week it's a different artist, different mediums, different artists. And then at the end of 10 weeks, we have an art show. And even though that doesn't sound like a big deal, it is a big deal. When you put somebody's piece up on a wall and you go, you did that. Look how beautiful it is. Look how amazing that is. It goes to a whole other level. It goes to a level of acceptance. And not only that, they feel like they've overcome a lot of things. And then we take their artwork and we put it in a giant show at the end of the year. And now there's 550 pieces of art from 550 different artists. And then they're judged in jury through their peers. Everyone gets little red dots of their favorites. And at the end of that show, we walk away with 50. And that 50 then goes on tour. And we're in museums, we're in galleries. I mean, I always tell them, I'm at a museum, your art's hanging up in a museum, So then, and not everyone gets into that, but that's okay. But there's aspirational goals. They can see where things could end up. Same thing with the music, they have a concert at the end. So all of these things all have that validation side of it too. And when parents and families and your friends go, wow, you really did something very cool here. It's not just a piece of art or something that you just do and then you put it in a drawer and you never see it again, right? It's being able to honor the creation of what they just made, whether it's a single dot again or it's a beautiful rendering. It's that opportunity to validate and for all of us to go, you did a really good job, And we encourage all of our family and all of our, our caregivers to be part of that, to honor that, and I think that's really important.
Constance, I'm going to ask you a little bit different question. If you could make one bold change to the way that we support caregivers across the lifespan, whether it's through funding, policy, or philosophy, what would it be?
Education. So I need a GoFundMe, to start a GoFundMe. And with those funds, I want a Super Bowl commercial. I'm thinking big. I think it's $3-4 million. Education, awareness of all the opportunities of how you will feel as a caregiver, as a care receiver, anyone, how you will feel when you shift stress to vitality. Because you don't have to live in stress. You don't have to live in orange. You don't have to live in red. And I find that working with caregivers and when their children come in or the care receivers come in for treatment, for either a Reiki treatment or an energy hygiene treatment. Usually the caregivers are like, you know, this is just another Tuesday for me. They've accepted this level of stress. And studies are showing that it's not the high stress day. By the way, you know, it could be an exciting day, it could be a wedding, or, you know, it could be a really good celebration that's bringing you, you know, this adrenaline, this cortisol, which is good. But it's that daily grind, daily stress that people accept that this is just part of their definition of their lives. That, okay, this is me. You know, I got a neurodiverse child, I have a spouse, I have to go to work, I have to do this, and it's constant from 5:45 in the morning to 10 at night, and by the way, they're not sleeping. So the awareness, the education of just the simple tools that we could do on a consistent routine basis. You wake up, you brush your teeth, you take your shower, now you're gonna do your energy hygiene, right? Maybe it's just a simple tapping. Maybe it's just simple, just closing your eyes and programming the day. But the awareness and the education, and that Super Bowl commercial, just you wait.
Thank you.
That's what I would.
Michael, how about you? What would be that bold change in the way that we support caregivers across the lifespan through funding, policy, or philosophy?
I think you're on it with the education and awareness, but I think there's ways of bringing that to the forefront. I think, you know, like the work that all of the people are doing, all of us are doing, is to actually bring it to the forefront a little bit more in conversation, in opportunities. You know, even in the vocational world, you know, we have a digital arts program as well, not just fine arts, and we're actually showing individuals that they can make careers out of art. You know, they can actually create digital art, they can do podcasts, they can do websites and social media. You know, so bringing awareness even on a vocational side that individuals in the IDD world have opportunities. And I think that's what everyone wants to feel, is an opportunity, right? Do I have an option here in this life, or I'm stuck in this one lane? And I think what we're trying to do is open the eyes and the opportunities for individuals that they can have careers and they can have a life of happiness and what that looks like. But more importantly, it's them being aware of that. A lot aren't even aware of it. You know, they're sitting on screens every day and they're like, oh, I can make money at that? Yeah, you can make an ad, you can make it. You know, so giving the people those chances in this world, I think, are the most important things.
Thank you. Peter, you're very involved, you know, with funding, to some degree also policy, in terms of how you structure those programs. So in regards to thinking about that bold change and where you would like to see things move in the next 5 years for the integration of holistic wellness for our individuals with developmental disability from that funding and policy perspective, what's kind of on your wish list where we would move?
So we embarrassingly created this therapist guide, and we're all proud about saying it has 4,000 downloads and everybody's using it. And we only are now, after the fact, getting a lived experience voice about what do you think about this guide we created? Are we talking to the therapist the right way? Are we understanding your situation? What do you think of this term neurodiversity and these tools that we created? Do you think that's a way to teach it? So we're doing it backwards, right? And and when you get that voice, and it's such an aha experience, and it really sometimes shifts the whole landscape, you know, and the foundation or the premise of what you're doing. So lived experience voices like Laura, getting Laura to the table, getting the recipients of our interventions and our programming and say, what's this like for you? How can we do it better? Bring them to the table and and that voice really matters and has influence there.
Thank you. Dr. Pape, how about you also, funding and policy changes that could support these holistic wellness, integration of holistic wellness?
Well, there's definitely a few pieces to that, right? So if we talk about from the caregiver aspect, again, it's about, we have this funding for the people who have, neurodivergence and things like that, but where's really the support for those people taking care of them? Yeah, there may be some money for you to do some services or to pay for that, but where's your mental health support, right? I think mental health is something that has come to the forefront in this country a lot in the last number of years. Like before, it was like this kind of thing behind closed doors, and when you went to a psychologist, but it was a bad thing, or if you took a med. But now it's out there, it's front and center, but how is it treated? It's a pill for every ill at this point, right? No one's really getting to the root cause, and no one's really getting to the reason why. So if we can put more funding into things like, or support behind the things that can actually help beyond the traditional medicine system. And unfortunately, and again, I'm not always outlining alternative medicine guy up here, but the traditional medical system is where a lot of those things go, and a lot of it's based on, here's your pill for this ill, and here's this drug that gives this thing Abilify, whatever it may be, and here's your drug, now go back and take care of one of those kids, and here's their drugs, right? What are we doing to understand where that load's coming from? What are we doing to take that load down? And how are we getting for both the patient and the caregiver? I think that's where there's not enough funding, and there's not enough voices outside of the traditional medical system in general that are heard to help with that. And I think a lot of funding should go to things like that. I think that just in general, looking into the holistic alternative care outside of the traditional lens of how it filters through a healthcare system that's medical based could actually get more results. Because we're people like myself and other doctors I know, we're out there doing this work already, but no one knows. No one's sent to us, and we're not, and I'm not just saying, oh, woe is me, I'm just talking that there's a whole population of people that are being served for this that have to go find it on their own outside of it, because it's not considered the normal mainstream. So if we could put money more into those kinds of things, I think we can make a bigger difference in how everyone's cared for.
Thank you. So that kind of pulling all of these themes together, and you worked within the OPWDD system for so many years. You talked a little bit about bringing that conversation into the person-centered planning discussion, but taking a larger view of this, and perhaps a wish list view of this from a more of a system perspective. What do you think OPWDD could do to help better support caregivers in all of these areas of both physical, mental health, and spiritual stress?
Well, as I stated before, as a nurse practitioner, we're more medication targeted, but for me, I am totally functional, integrative, and I think, like the panelists just said earlier, we don't focus on mind, body, and spirit. Everything is a pill. You're not sleeping, here's a pill. Oh, he's acting up, here's a pill. No one's looking at what you're eating. Are you drinking too much Kool-Aid, too much dye? And no one's looking at the person as a whole. Where did this disease come from? Where does this anxiety come from? Is it something from childhood? Is it something growing up? Is it some type of trauma? So we're not looking at everything. And I wish that moving forward, OPWDD, OMH, AABR, that we look at everything as a whole, and when we do have meetings with the family and with the individuals, we take heed to what they're stating, how they feel, and implement things to help them, whether it's respite care, giving them a week off, maybe taking some funds, sending them, helping them with respite while they take a vacation. Whatever it is, the lessen the load is what I would think they need to do. And again, listen to everyone's concerns.
So I wanted to offer the opportunity for some of our participants here in the audience to ask related questions to our panelists. Does anybody have a question they'd like to ask? Oh, great. Come on up. You wanna come closer so we can hear you.
Okay. Well, I became a caregiver about 20 years ago. My husband ended up getting a stroke. And luckily, it was a morning where it was my birthday. And I haven't been home, but he did get a stroke. And what happened, he got a stroke and stuff, exactly his head. And it was so painful that he just kind of like slipped right down. But like I said, luckily I was home and I was the ambulance. And he was sent over first to Napa. And luckily that morning, Dr. Yama, who worked at Stonebrook, who was the head of the, I guess, his surgeon, he was there and I had shipped my husband over to Stonebrook. But my point is, I was in such an unknown place that it was almost like, oh, okay, he's just gonna go. That's what it was. Well, it wasn't.